Parkinson's disease is a brain disorder. It affects movement and often worsens over time. More than 10 million people worldwide live with Parkinson's. This disease is progressive, meaning it gets worse over time. There is no cure for Parkinson's yet, but treatments can help manage symptoms. Parkinson's affects everyone differently. Some people have mild symptoms. Others experience more significant challenges. It is important to remember that people with Parkinson's can live full and meaningful lives. To understand Parkinson's, we need to look at the brain. The brain is a complex organ that controls everything we do, from our thoughts to our movements. It's made up of billions of cells that communicate with each other through chemical messengers. Deep inside the brain is an area called the substantia nigra. This small but crucial region plays a key role in movement control. This area produces dopamine, a chemical messenger that helps control movement. Dopamine is essential for smooth and coordinated muscle movements. In Parkinson's, the cells that make dopamine start to die off. This cell death leads to a decrease in dopamine levels in the brain. As dopamine levels drop, it becomes harder to control movement. This lack of dopamine disrupts the brain's ability to send proper signals to the muscles. This leads to the tremors, stiffness, and slowness that are common symptoms of the disease. These symptoms can severely impact a person's daily life and activities. Scientists are still working to understand what causes these brain cells to die. Research is ongoing to find better treatments and, hopefully, a cure for Parkinson's disease. Parkinson's disease often starts subtly, with symptoms that can be easily overlooked. Early signs can be easy to miss, as they often resemble normal aging or other conditions. One of the first symptoms people may notice is a slight tremor, often in a hand. This tremor can be very subtle at first. The tremor may be more noticeable when the hand is at rest, and it can become more pronounced over time. Movement may become slower, making everyday tasks take longer. This slowness, known as Bradykinesia, can affect daily life significantly. Muscles can feel stiff, making it hard to move freely. This stiffness can lead to discomfort and reduce mobility. Changes in speech and handwriting are also common. People may find their voice becoming softer or their speech more monotone. People with Parkinson's may speak softly, or their writing may become smaller and more cramped, a condition known as micrographia. While there is no cure for Parkinson's, there are ways to manage the symptoms and improve quality of life. This can be achieved through a combination of medications, therapies, and lifestyle changes. It's important to work closely with healthcare professionals to develop a personalized treatment plan that addresses individual needs and goals. Medications can help increase dopamine levels in the brain, which can alleviate some of the motor symptoms associated with the disease. These medications need to be carefully managed and adjusted over time to maintain their effectiveness and minimize side effects. Physical therapy can help with balance, flexibility, and strength. Regular exercise and physical activity are crucial in maintaining mobility and independence. Therapists can provide tailored exercises that focus on improving coordination and reducing the risk of falls. In some cases, surgery may be an option. Surgical interventions such as deep brain stimulation can be considered for patients who do not respond well to medications. These procedures can help manage symptoms and improve quality of life. Deep brain stimulation is a procedure that involves implanting electrodes in the brain to help regulate movement. This technique can significantly reduce tremors and other motor symptoms, allowing patients to regain better control over their movements. Living with Parkinson's can be challenging, but there is hope. Support from family, friends, and support groups can make a significant difference. Sharing experiences and connecting with others who understand the journey can provide emotional strength and encouragement. By raising awareness, supporting research, and showing compassion, we can make a difference in the lives of people living with Parkinson's disease. Community involvement and advocacy are key in driving progress and finding better treatments. By staying informed and supportive, we can help create a brighter future for those affected by this condition. Education and awareness are powerful tools in the fight against Parkinson's, and together we can work towards a world where everyone affected by this disease can live their best life.